Hi, good morning. Happy Friday, Wakefield. Thanks for joining us for the October 15th edition of our COVID update call. Town Administrator Mayo and Superintendent Lyons have a conflict today, so I will be your host. I do have some school information from Superintendent Lyons. Before we start, I just want to remind everybody, if you want to view the dashboard, Wakefield's dashboard, it's at wakefield.ma.us, and there's a COVID tab in the top navigation. That gets updated Thursday nights, sometimes real late Thursday nights, but I do it each Thursday night when the state data comes out. I also want to remind everyone about flu clinics. I know this is a COVID call, but we're entering flu season. So the Health and Emergency Management Departments have set up 2 upcoming flu clinics. The first one is tomorrow at the Farmers Market, which is over next to Wakefield on North Ave. And the other one is on October 21st, which is next week. It's at the Galvin Middle School, and that's a drive-through. So you literally just drive on through and get your vaccine. You should register in advance, saves a lot of time and allows you to secure an appointment. So you can go to wakefield.ma.us. There's a big flu clinic tile on the homepage. You can click on that, view more information, and there are the links to sign up. So I hope everybody takes advantage of those clinics. I will turn it over to our health director, who can share a little bit more information about some of the data that you are going to see on the dashboard.
Thank you, Jen. So we're going to go over a little bit of the cases here in Wakefield. We've seen a slight uptick in average daily cases. We're at about 5 average daily cases. We have less since last week. Since last we spoke. We have less active confirmed cases, and so we've been doing a good job in terms of getting folks tested. We've seen a decrease in the percent positivity rate here in Wakefield. And our contact tracers are working hard to make sure everybody is aware, of the resources out there for them, as well as the protocols associated with testing positive. As we're looking at the vaccination report, we've seen a slight increase across all age groups in terms of having 1 dose of the COVID vaccine. However, we are still trying to get folks vaccinated. We haven't seen much change in the percent fully vaccinated in the 12 to 15 group or the 20 to 29 age group. So really hoping that individuals will, come ask us questions if there's any concerns about the vaccines. We are a great resource, as well as your primary care physicians. We want to make sure that everybody has, the chance to get the COVID vaccine. And in most cases, it is definitely safer to get the vaccine over catching COVID. And then we're looking at the schools. Our school nurses have been doing an amazing job in terms of keeping up with test and stay. The program has helped keep a lot of kids in school, and we're trying to make sure that students and staff are safe. Currently, we have 21 students that tested positive and 1 staff member. And so we're really trying to make sure we're getting all the information out there for everyone about the numbers. And we've been hearing a lot in the news about the possibility of a shot for COVID shot for those 5 to 11 years old. And so we've been in talks with our local groups, our Board of Health, as well as our emergency management groups, to discuss how we will deploy this once it becomes approved. And so we will be posting more information once the shots are available to us. There is the booster for Pfizer. For those generally recommended, those are over 65 and those with underlying conditions. Those are available at the nearby CVS and Walgreens and other primary care physician offices. We also have news about a Moderna booster shot coming out, and so they have just filed for emergency authorization with the FDA. And this is to be seen once they get approved. We will make sure to give information on where you can get those. Thank you.
Thank you so much, Anthony. We have our Emergency Management Director, Tom Walsh, on. Tom, do you have anything to add?
No, I just reiterating what Anthony said, plus, just please get vaccinated. And, when you're eligible to get the booster. I wasn't going to say anything else, but I read something that's troubling to me, and The state of New Hampshire, the executive council turned down $27 million in vaccination money that the federal government was giving them on a grant because they were intimidated by anti-vaxxers. It's the craziest thing I've ever heard. You know, that state needs, you know, to get vaccinated, get their booster shots, and to turn down $27 million because, you know, a group comes in and they haunt you when you're trying to pass these rules and laws. It's just crazy. You know, our state a little better, a little smarter, our community, same thing. So I just, please, everybody use their head, listen to the experts. You know, our new public health director, Anthony Troy, a great resource. If you have any questions, his department will help you out. If you have anything at all, any questions at all on it. That's all I have to say.
Thanks, Tom. We also have two ladies fresh off a late night meeting from last night. Thank you for getting up so early. Vice Chair Maureen Butt, do you have anything that you would like to discuss?
No, Julie, Chair Julie Smith-Galvin couldn't make it today, so she asked me to fill in, which I was gladly going to do anyway. I'm going to say the same thing we say every week. Thank you all for all the work that you're doing. You know, I think I'm really impressed by the flu clinics. I've signed up for the one on the 21st, the drive-through. I'm hoping Laurel will continue being the person who gives me my shot. I also just want to make clear, it does ask you for insurance information, but I know that if you don't have insurance, you can still sign up. That is correct, right? So it's available to all. So please sign up. Hopefully people will be able to go this Saturday or the drive-through one on the 21st. And just again, everyone's doing a great job. Thank you. And I also just wanted to take a minute at the start of the call, just thank WCAT for, you know, allowing us to do this every week and everything you have all done during the pandemic. So thank you.
Thanks. And they're probably off a late meeting too. Laurel from the Board of Health, do you have anything you'd like to add today?
Just good morning, all. We are, you know, I had the opportunity to sort of do a year in review last night, and can't thank enough again the people who helped us with our vaccine clinics way back last winter and early spring. This is, you know, remains a moving target. It's I think we're transitioning from our kind of state of emergency to an evolving situation, and that we're being, we have a little bit more room to breathe, but we're still really working hard. I can tell you just from personal experience hearing from someone from a different municipality that not everybody is getting their contact tracing calls, and we're really fortunate that we have fully staffed. That effort is taking a lion's share of the work of the department. And I think, you know, that Wakefield, you know, that most people know what to do if they test positive, and they kind of just figure it out. I will be myself and Elaine Silva, and we might pull in somebody else to do vaccinations tomorrow. So in regards to any questions around vaccinations in general, both of us are a resource. So we'll be at the farmers market. I believe the rain is early morning and late afternoon, so I think we will be fine under our tent. I signed up myself for Elaine to give me my shot at the end of the day, and I didn't, you know, I found that the new system is not very onerous. There are a few places that are not necessarily required, so I know that, you know, some people, you know, like some people don't have a second number on their insurance, for instance, and that's okay. Our admin will get you through that. So I hope to see as many Wakefieldians line up for flu vaccine. We are worried that it could be a tough year for flu, and a double hit could really be a public health issue. So come on down and stay well.
Thank you. And don't forget short sleeves if you're going to be.
Layers.
Yeah.
Yep.
So before we close, I did just want to share a little bit more information about the school data that Superintendent Lyons sent over. There were 12 new cases since last week in the school system for students and 1 for staff. 3 at the Dolbear, 6 at the Galvin, 2 at the Greenwood, 1 at the Woodville, and the staff case was at the Doyle. Interestingly, there were no students at the Doyle. And then quarantine data, there were 100 quarantine students across the school system, 0 staff, and I think as Doug mentioned last week, a lot of that is parent-led quarantining. So that's the data that I have this week, and I hope that everybody is well and takes advantage of the flu clinics, and thank you for joining. We'll see you next week.